Hi guys, I'm Liz. I'm one of the nurses here at Beth MD and Results Medical Spa, here to talk to you about lasers. And the first one I'll be kind of touching upon is Moxi. So for me, Moxi is kind of my bread and butter here at the practice. It's something that you can do kind of correctively or as a maintenance type of laser. It's something that I do at least 2 to 3 times a year, and it's something that's really transformed my skin overall. Basically, Moxi is a non-ablative laser which targets water in the skin. So it's not actually creating any open channels of skin, but what it does is by heating up that water in the tissue, it helps to tighten. So you're shrinking pores and also lifting pigment, especially stubborn pigment like melasma. So I myself struggle with melasma and hyperpigmentation as somebody of a deeper skin type. This laser is really excellent for people who have sun damage, brown spots, and also just having enlarged pores and you're looking to polish, brighten the skin, and just make it overall softer. This type of laser you can do pretty much anywhere on the body, but most often we do face, neck, and chest. So like I said, I myself as a darker skin type can do this laser, so it can pretty much do anybody from really fair to African American skin. So because it's targeting water, it's not really targeting melanin specifically, so anyone can do it. The only contraindications really is pregnancy, breastfeeding, if you're actively using Accutane or have been off of it for less than a year, people who have different kind of skin conditions like keloid histories, or if you're on any specific medications. I already mentioned Accutane, but also using steroids as well. Definitely something to talk about with your provider and kind of getting more information through a consultation. So let's talk about downtime, which is probably the most common question I get asked. So Moxi, I feel like in comparison to other lasers that we offer in the practice and other treatments, probably is more of our more minimal side of downtime. Not to say that it doesn't involve swelling, peeling, things like that, and avoiding sun. We still want to keep in mind about how delicate the skin is. So as far as expectations, you can expect to have a little bit of swelling depending on the settings that we're using. Your provider will choose based on your treatment plan, but more often than not, I would say you can expect 1 to 3 days of swelling and redness. Typically that can be combated with icing, ibuprofen, and keeping your head elevated. You can also do some antihistamine use if appropriate for you. And then usually by days 4 to 7, you'll start to experience a little bit of some peeling. So immediately after the treatment, by later that day or that night, you'll start to see speckles all over your face, and that's just from the laser kind of heating up the tissue. So that old skin will start to flake off. And then by days 5 to 7, you'll really start to see that new skin coming up, those tightened pores and that polished glow that most people really love to see. And then usually I would say sometimes people still linger with a tiny bit of redness, and I usually say people are fully healed by a week, but best results within 2 to 4 weeks. So how many treatments does this require? So luckily at our office we offer packages. More often than not, if you're doing this for hyperpigmentation purposes like myself with melasma, you want to do it in a corrective fashion to really optimize keeping that melanin at bay. So in combination with a laser, we'll also combine this with topical treatments to keep that melanin tamped down, but normally we would do probably a series of 3 treatments 1 month apart, and then you would go on a maintenance plan. So there is a corrective phase, and then you can go on to a maintenance phase. Some people can just opt into doing this kind of every quarter, which is totally fine with us. You may expect to have a little bit more of an aggressive treatment if you're kind of going in that fashion, but most people choose to do the series, especially if you really do have significant sun damage or hyperpigmentation. You want to maximize your results to kind of get to your goal faster and then maintaining over time. So for myself with melasma, I did do back-to-back treatments, and then I'm now kind of at a biannual frequency. But it really does help to keep that skin youthful and glowing and really keep the skin polished and tight. So like I've discussed, this laser is really amazing. I personally use it myself. I love it for majority of my clients, young or a little bit more mature skin. It just really can transform your overall appearance and youthfulness, and targets both a little bit of texture and tone of the skin, which kind of both contribute to aging. So if you want to learn more, please call us and schedule an appointment for a consultation, and we would love to see you.